This is Eliza, a 12-year-old girl who was diagnosed with persistent tic disorder, or PTD, at age 8. Her disorder has only worsened with time, and she has developed both motor and vocal tics in the last 2 years. She's decided to go to Tourette's specialist and behavioral psychiatrist Dr. Jenkins to try and get treatment.
Hi, I'm Dr. Jenkins.
Hi, I'm Eliza.
Take a seat. So what brings you here today?
I was diagnosed with PTD a few years ago and got medical treatment for it. But in the past couple of months, my ticking has started to get worse. Also, I've been struggling with my medication because it makes me really sick feeling, and I don't go to sleep easily, Leaf. My parents are wondering if there's any options for treatment.
You said your ticking had gotten worse. Do you have both motor and vocal tics now?
Yeah, I've always had motor tics, but I've recently developed vocal tics.
How long have your vocal tics been occurring?
I think it's been a little over a year now, but I didn't think it was a problem because of my PTD, but the vocal tics have been occurring in Leaf a lot more frequently.
Unfortunately, it sounds like your PTD is now full-on Tourette's disorder. This disorder is much more common in males and females, but in females it's often more likely to come with anxiety and depression. Tourette's tends to peak before puberty and lessen by adolescence, so hopefully this is the case for you.
So it's gonna go away?
Well, not totally go away necessarily, but your symptoms should stop worsening and the disorder should naturally become more manageable as you age.
Well, that's a relief. That's a relief to hear. What's the difference between PTD and Tourette's?
The main difference between PTD and Tourette's disorder is that with TD you have multiple motor tics and one or more vocal tics occur, while in PTD you have single or multiple of either type of tic, but not both motor and vocal. With the introduction of your vocal tic, you now have a mix of both, which makes it Tourette's. The diagnosis of Tourette's also requires that you've had the tic for over a year, which you said that you have.
Oh, but it's like PTD, right? So it's not curable either?
Yes, it's very similar to PTD, and like PTD, it does not have a cure. Research is being done to identify the cause of these tic disorders, and the current theory is that it's caused by a miswiring in that part of the brain called the basal ganglia, which controls voluntary motor movements.
That's interesting. If PTD and Tourette's Leaf are so similar, then why do you have to diagnose me?
Diagnosing you with Tourette's will allow us to give you a better treatment, more tailored to Tourette's. There's also a lot more research being done for Tourette's than for PTD, so there's more information we can use to treat your diagnosis.
I guess that makes sense.
Tourette's is the most common tic disorder, so it gets the most research, which is good news for you. Now remind me, what medications have you been on lately?
I'm on Leaf haloperidol and fluoxetine, but they make my Leaf side effects worse, and my tics have only gotten bad.
Fluoxetine is a selective serotonin reuptake inhibitor, or SSRI, which wouldn't work well if you had OCD, but since it hasn't caused any OCD symptoms, I don't think that you have OCD. Some medications, like your previous medication, haloperidol, are called antagonists and work to block dopamine from being released, which is supposed to help inhibit some of your tics. You haven't been diagnosed with OCD or ADHD, have you?
No, just with PTD, Leaf. But why am I on those if I don't have the disorder?
Since Tourette's is commonly comorbid with ADHD and OCD, sometimes medicines are given to try to treat both. Since the cause of the disorder is still unknown, there are no medications specifically for Tourette's, which makes it hard for psychiatrists like me to treat patients like you with medications, especially trying to find ones that don't make you experience a lot of bad side effects. I think for you, we should try a different approach without medications.
Yeah, I believe I've always had bad side effects with my medicine. What else can I do to treat it?
I've had lots of success with my younger patients with behavioral therapy, and I think it could really be beneficial for you.
As long as I don't have to take pills anymore.
Okay, so to start behavioral treatments, I need to ask you a few questions. Do you ever feel an urge before a tic?
Yeah, it feels like I need to leave. It feels like I need to blink. It gets worse the longer I hold it in.
Yeah, that's called a premonitory urge. Medications attempt to decrease these urges but aren't always successful. This is why I want to try a more behavioral method.
What does that mean?
Well, behavioral therapy was introduced and popularized in the last 100 years by Pavlov, Skinner, and other behaviorists. It uses classical and operant conditioning to separate dysfunctional behaviors and relearn and enforce new behaviors. The behavioral method I want to try for you is called habit reversal therapy. We are going to be doing a subtype of habit reversal therapy that's specifically for tic disorders like yours, called comprehensive behavioral intervention for tics, or CBIT.
CBIT? How does it work?
CBIT is a management technique that takes advantage of the brain's plasticity and ability to rewire itself, and it's been proven effective in many case studies. For example, a case study in 1990 by behavioral psychologists Azrin and Peterson compared habit reversal therapy to a controlled group of 10 children your age and adults. Each patient received an average of 7 sessions over a 4-month period, all involving direct observation, tic frequency counts, and CBIT training. They found that it was 93% effective at reducing the tic conditions compared to a 14% by the control group. This was such a turning point because many medications to treat TD, like the medications you've been on in the past, are usually only 50% effective. This is compared to the many studies about haloperidol and fluoxetine done by clinical psychiatrists like Dr. Shapiro, which gave these drugs an average of a 78% effectiveness rate. However, the side effects appear to be detrimental long-term to the patient's cognitive functions. I know this study doesn't make much sense to you, but I will give these studies to your parents in case they are skeptical about taking you off of medication. All you need to know is that this method will work much better than any medications you've been on.
Well, that sounds good. So the brain is going to rewire itself?
It's very cool. The brain is an amazing thing, and it's especially easy to rewire it while you're young and still growing like you are.
Okay, Leaf. So how do we start the therapy?
The first step is to identify your different types of tics and urges you feel day to day, which is called self-monitoring. The next is to think of competing responses that you can use when you begin to feel the urge of a tic. It's supposed to make the tic much more difficult to accomplish by doing a movement that is opposite to your normal tic.
Like what?
For tics like your arm movement, you can try to tighten up your muscles and move it out to prevent it from going in, or try to keep it tight against your body. Relaxation techniques also should help when you begin to feel urges. These include deep breathing exercises, music, meditation, and even yoga. These are things that can help if you can't change your environment or get rid of stressors like when you're at school. If you're having a lot of tics, you can try to use these while in class or step out of class for a minute to use a relaxation technique and then go back in.
I can do my best to get out of class, but I don't think it's always going to be possible, Leaf.
That's understandable, and that's why we're learning both competing responses and relaxation techniques. Hopefully by using these differing techniques, we can make a real difference in your life.
Do you really think doing this is going to stop the tics?
The success rate is not 100%, but most patients say that their urges over time are drastically reduced due to CBIT. It can even eliminate the tic altogether. The best part is that you won't have those medicine-induced side effects anymore.
Sounds awesome.
So do you want to try one of the competing responses now?
Sure.
Okay, for your right arm, try to tense up your muscle and keep your arm straight when you feel the urge to pull it into your chest.
Like this?
Yeah, that's awesome. When you feel that specific urge coming on, keep your muscles tense and arms stretched out. With practice, it'll get easier, and with self-monitoring, you should be able to become more aware of when you need to tic, and you can try doing these competing movements.
Can competing movements work for my vocal tics too?
Yes, and you can try doing deep breathing and pursing your lips if you feel an urge to tic. Can you try to deep breathe with me?
Okay, Leaf, I'll give it a shot.
Ready? Breathe in, hold, and breathe out.
Like that?
Yep, you can also do deep breathing whenever you feel stressed and need to relax. Stress may cause your tics to occur more, so if you're in a stressful situation, you can try to breathe and see if it helps. This and doing more competing movements will get easier as you get better at self-monitoring.
Okay, I'll try doing these, Leaf.
Keep in mind that it won't work at first. It takes practice, so try not to be upset if it doesn't. Just take a moment to relax. It may be frustrating while you're learning, but I think you will have serious success with this.
Thank you for everything. I'll try these new movements out.
Great! The standard treatment for CBIT is 8 sessions over 10 weeks. However, we will adjust based on your progress. So for the beginning, I want to meet with you every week to see how you're doing with new therapies and do more training. I have briefed your parents on the treatment and also have taught them about the movements I want you to be doing. This treatment is only going to work with constant practice. I know you can do it. Good luck. If you have any questions, you can always call my office. See you next week.
Okay, thank you. See you soon.
Thanks to this behavioral therapy, Eliza has been able to control her urges more. Tic disorders can happen to anyone. Occurrence rates and clinical characteristics don't vary due to race, ethnicity, or culture. However, cultural standards and stigma impact how tic disorders are perceived in different families and communities, and can ultimately result in different approaches of treatment. Tic disorders are serious illnesses that harshly impact life, so hopefully Eliza's disorder can be controlled with the help of her behavioral therapy, CBIT.